Hypercalcemia, if you've got the question of hypercalcemia, okay, what does it mean? Well, if you run a laboratory and you've got a new lab test, hey, you got a new calcium. What's the normal level of calcium? You know what you do? Find 100, supposedly normal people, do the blood test. The top 2.5% have hyper, the bottom 2.5% have hypo. In other words, normal is 95% of the normal population, right? So by definition, 2.5% of you have hypercalcemia. You go, I feel fine. Who says I've got hypercalcemia? But it's just a sort of normal thing, right? It's asymptomatic. And this is just putting it in as a confirmatory publication if one wanted to look at. But the way laboratories determine normal is normally the 95% confidence interval. Now, vitamin D toxicity, when looking at it, policymakers fixate on hypercalcemia, which I would argue is 2.5% of the normal population. And often you get cases where somebody says, I've got hypercalcemia, and the person's taking 5 vitamin D pills because the manufacturers instructed it or the doctor instructed it. That hypercalcemia, I'm going to sue the person who told us to take that much vitamin D. And they come to you, and this happened to me. You get, you're an expert consultant, and lawyers will call you and say, I've got a case that I'm trying to try of a case of hypercalcemia, and we think the vitamin manufacturer was poisoning people. And then well, what was the dose? What was the situation? As an expert, you respond back, I don't think that's likely to be causing vitamin D toxicity. And the lawyer is going to say, okay, I'll maybe call you back later. Well, what you just gave up was a $600 an hour job, because that $600 per hour as an expert witness builds into thousands of dollars that you just wasted. I mean, if you wanted to cheat, you could have made money. So what you really need is some index that proves beyond reasonable doubt that a high vitamin D is actually causing hypercalcemia. Years ago, I surveyed occurrences of 25-hydroxy-D and related it to patients who, in case reports, were stated as having hypercalcemia, and that's these X's up here. And the people who were suggested to have been the result of hypercalcemia due to vitamin D were taking 1,000 micrograms or more of vitamin D. That means 40,000 units or more, or a milligram or more of vitamin D per day. This is just case reports. It doesn't prove anything. A lot of people were normal, these white dots, taking the same dose. So you can't really prove based on case reports that you've got anything going on. And incidentally, on a nice day, of what's called the minimal erythemal dose, the amount of ultraviolet light that will not quite turn you red, introduces into your body the equivalent of having taken 10,000 units of vitamin D3 on a given day. That's a substantial amount and much higher than roughly the 600 units that's likely to be in your vitamin D pill. A quart of milk has 400 units. You'd have to drink a lot of milk to make up for what you could get if you were not sitting in this class and instead, sat in a nice time outside. Most hypercalcemia, quote, is asymptomatic. It might even just be part of the upper normal range. It could represent primary hyperparathyroidism, a kind of an adenoma or cancer of the parathyroid gland, which is something that should be treated. It could be cancer. Probably the most common cause of hypercalcemia is that there's a metastasis at the bone, releasing the calcium from the bone. And of course, vitamin D might be causing toxicity, but how do you prove it? It's a legal issue, and you have to prove something beyond a reasonable doubt in a courtroom. And I could probably talk you out of thinking something is vitamin D toxic the way I'm talking, I'm hoping. What I want to also remind you, if you have anything to do with pharmacy and modern technology and terminology, is a sort of a real grudge of mine. The terminology has become extremely sloppy by physicians and everybody when it comes to vitamin D. They forget that there's a difference between vitamin D, 25-hydroxy vitamin D, and 1,25-dihydroxy D. If you provide a prescription in most pharmacies for vitamin D, it'll be for calcitriol, 1,25-dihydroxy D. Why? Because it's a hormone produced by the kidney, and people with kidney failure require replacement hormone for that kidney hormone, 125. So it's easy to screw up and call that kidney hormone calcitriol. I misspelled it. 125-dihydroxy vitamin D is calcitriol. Calcitriol is a hormone, not a nutrient, and don't get them mixed up. When you hear the word vitamin D, ask yourself, what exactly are we talking about? And it's not a trivial thing. It seems obvious when you're sort of talking in this context, but people make mistakes about the terminology, and always know where you are on that bucket list that I showed you earlier.